Egypt, where the recent spikes in COVID-19 infections in the country has led to the partial closure of public places such as restaurants and business centers as part of efforts to contain the virus. During Ramadan, many people are said to be disregarding the health protocols in their daily activities, leaving authorities worried of the gradual rise of new infections. The country's hospitality industry is exempted from the closure, considering the state of the economy. And here's more details of that in this report.
The latest partial closure is a reflection of the steady rise in COVID-19 cases over the last 2 months in the North African state. Authorities have warned Egyptians had been relaxing health precautions lately.
We commend the government for this decision. Many places were packed with people either shopping or gatherings at outings and parties during Ramadan have increased. Symptoms of the virus were known and clear to us, but now the symptoms have changed. In a lot of cases, there's no high temperature. The lungs can be infected without the patient feeling it at first, and other symptoms manifest in the digestive system, in the eyes and ears. So it's becoming tricky but dangerous because you do not notice it's a coronavirus infection until it's too late.
Though the situation has been worsening, the government had refrained from an all-out closure. This is in a bid to protect its economy from the pandemic-induced slowdown.
At the onset of the coronavirus pandemic last year, we adopted a partial closure followed by a full closure and curfew in the first quarter of 2020. This led to a 1.5 economic contraction for the first time since 2011. We are learning from the past experience by adopting only a partial closure for now to have the least effect on the economy.
Tourism, a main source of foreign currency, has been hard hit by restrictions imposed to curb the COVID-19 pandemic. That's why hotels and private beaches were exempt from the early closure. But the tourism ministry has upgraded health procedures and has been sanitizing hotels, tourist sites and museums. Maintaining a balance between health measures and economic stability is a main factor for the government at this stage.
I believe the negative economic effects will be minute during the third wave. The GDP numbers are normal so far. We are entering the summer season. Last June, July and August, we saw a significant drop in infection rates. We are at the same period during into the summer, so I think the third wave will be contained quicker than last year.
Meanwhile, health authorities are working hard to curb the spread of the virus.
Adoption of health measures and vaccinations is the way out. Countries that have inoculated a high number of their citizens have seen a drop in infection rates. At this point, our main option is sticking to health measures. Everyone must deal with others as if they are infected and take the necessary precautions. We have to take the vaccine. Many are refusing in fear of side effects, but there's no alternative. We must all get vaccinated at a short period of time so that the chances of infections will drop.
The government hopes the closure of the restaurants, malls, and the ban on mass gatherings and weddings would prevent a further spread of the pandemic, especially during the Eid festivities. The government had set the closure until the mid of May. However, it has warned that if the number of cases does not go down, it will be extended until June.